Okay, so this is a general overview, and for you, for people that don't know, Mind is the biggest charity, mental health charity in England and Wales. So it kind of provides services for people that are suffering from anything from sort of like minor mental health problems right through to very complex mental health problems. And we're spread right across England. And yeah, we provide a range of services, and part of our services is what we call a mental health recovery program, which includes therapeutic activities. So if you move the next slide along. If we can, there you go, there you are. So I'm sure I don't need to tell everybody this, but we do sometimes just re-go over what forest therapy is, but I'm fairly sure everybody on this call knows what forest therapy is. But the reason that we kind of introduced this into the mental health recovery program was because it hadn't been brought in as a practice before, and what we kind of realised was that for some of our clients, they find it very difficult to access nature. They also find it very difficult to maybe use mindfulness in terms of what you'd call the traditional type of mindful activities. And that there was something also about connection with forest therapy in terms of bringing people together, allowing them to do activities that they would not normally be given the chance to do in a safe space and in a green space. So there is a whole wealth of useful activities that forest therapy or forest bathing brings to people that have mental health issues. And we wanted to introduce it because we felt it was a very sort of thorough therapy to introduce. It has more than one strand of meeting our priorities as a therapeutic tool to work with individuals. So if we go on to the next slide. Okay, so as I was saying, we've got the majority of our service users, we work with around about 5,000 clients a year, and we're one area of London. So to put it in a nutshell, if anybody has ever flown into Heathrow in England, we are the area that looks after Heathrow Airport, and we're sort of one of the boroughs, probably the largest borough actually in London. But we have a number of very complex needs in this borough. So we have incredibly wealthy people, but we also have 6% of the most deprived people in terms of poverty living in England, living in this borough as well. And there is unfortunately a very good correlation between poor mental health and poverty. So what we found is a lot of our service users that have complex mental health needs come from the most deprived areas in our locality. And also they're the people that have the least ability to access green spaces. So we have a daily program of activities which we run throughout the week and on the weekends, which are based on looking at how we improve someone's mental health and that looks at various aspects of their life, everything from relationships through to money, housing, those sorts of issues. So we've got the practical aspects of it, but then we've got the therapeutic aspects of working with people with severe and enduring mental health issues as well. And what forest therapy has brought is something that is slightly different to traditional therapeutic activities. So traditional therapeutic activities may well be things like counselling or psychotherapy, maybe some creative arts, and some various different sort of, drama therapy, those sorts of issues. What's lovely about forest therapy is that it combines some of those issues through its invitations in what we're doing with people in a group, out walking in nature where they feel relaxed. Okay, if we go on to the next slide. So everything that we do at Mind has to be recorded and it has to be evaluated in terms of is it actually producing a good outcome for the individual that is taking part of something. So we basically when we run our forest therapy, we look at roughly an hour and a half to 2 hours in duration, and I suppose one of the things that is slightly different to a normal forest therapy walk or a forest bathing walk is not only do we route plan and check for health and safety issues, but we also look at the individuals that are coming on the session, and we get to talk to them beforehand and just establish whether we think they're well enough to take part. And that sounds like a strange thing to say. The majority of people that have severe and enduring mental health problems have I would say, a kind of a journey. Sometimes they are doing very well, and sometimes they're not doing so well. And dependent on where they are in that journey, depends on whether they can engage and safely engage with other individuals, and that they would benefit from the walk and the therapeutic activity. An example of this is if somebody wasn't well and was having a psychotic episode or was in psychosis, then this would not be an appropriate activity for us to take them on. So it's really important that we know the people that are coming and we check in with them to make sure that they're well enough to actually engage. So go on to the next slide. So this is what really is interesting for us, and one of the reasons that we're really trying to look at making forest therapy an activity, a therapeutic activity across not only Minds that provide services, but we're also trying to bend our health service into looking at whether this should be a therapeutic activity that their doctors can prescribe for them. So at the moment, our outcomes are measured through formal questionnaires. And the project has been going on since 2018, so we're kind of well into it at the moment. So 71% of people attending reported that their social isolation had improved. And this is actually looking at something called the Recovery Star, the Mental Health Recovery Star, which is an assessment tool and a program that we use where we're measuring outcomes and how people are feeling about things. Social isolation is a key issue with people with severe mental health issues. I'd probably say it's an issue for all people with mental health conditions. Feeling lonely and isolated, and not supported and not part of a community is a key issue in poor mental health. So the fact that social isolation had improved just from doing this group work was quite stunning for us. 62% of people surveyed reported an improvement in levels of self-confidence. And I think some of this is very much to do with the fact that the people are going out as a group. And some of the activities that they're doing allow them to do something independently. So those are some of the kind of like self-confidence issues, and also the fact that they're sharing things in group circle at the end. So our GAD scores, and I'm not sure if everybody knows what a GAD score is, but it's a general anxiety score. Basically, it showed that there was a 65% improvement in how anxious people were feeling. And our PHQ score, which is the score for depression, showed for the year a 64% improvement in depression. So how people were feeling in terms of their depressive illnesses. So if we go on to the next slide. So this is local surveys. And what was interesting for us was how many people actually really enjoyed the session and felt that actually it was highly beneficial to them. So 90% of the people attending felt the walk was beneficial and would recommend it to others. 80% of those surveyed reported an increase in optimism. So they felt happier once they'd actually done their walk. So this is a survey that is measured sort of after people have actually done the walk. 75% of people said that they felt more confident, and 80% reported improved self-management of their mental health. So what was interesting about this is that people are taking some of the work that we're doing on these walks and then actually translating that or moving that into their own personal lives. So slowing down in their own personal lives and actually engaging in nature by, even if it's just sitting with their plants on their balcony or going to their local park, they've changed their relationship to nature, and they've slowed down as a result of that. Okay, so next slide. So there are lots of quotations. We've done this on purpose because we felt very much that in every report that we write, we're always having to provide statistical information. And actually what we really did want to do was provide people's feedback on how they felt as a result of things. And I think this is, you know, I don't know if everybody can read this, so I can read them out if it helps with the translation. Even on difficult days when my depression is strong, I manage to get up and come along, and I'm always grateful that I do, as I feel so much better after the sessions, relaxed and less preoccupied about things. I feel relaxed and chilled after a session. It has a positive impact on my anxiety, and I don't feel so anxious and worried about things as my mind is taken off these things for a while. It's a great way to come out and socialise with people in the same boat, but in different surroundings. I feel closer to nature and welcome the chance to come out into nature with others. So if we just go on to the next one. And just some other bits. I have a physical health condition, asthma, but the pace is okay. And it allows me to do some gentle exercise in nice surroundings. I don't usually like groups, but this is great as it's not closed in. I feel better after a session, more relaxed and connected to other people and nature. And this is a really interesting quotation, because one, we've realized that, people sometimes feel that going for a walk is too much for them, especially if they have an underlying medical condition. And because this is a very slow walk, and it's very much about not the distance, but the journey that you're doing, people feel it's okay, I can come out and do this. It doesn't matter that I've got asthma, or we have a lot of people with chronic obstructive pulmonary disorder, so they have very clogged up lungs. They feel like they can still come and engage in on the walk. The other interesting thing about this individual as well was that the majority of the work that we do is inside, it's in rooms, it's in groups. And the fact that this individual actually said, I don't mind it being in a group because it's outside, and there was that kind of feeling of not being enclosed and not being stuck or unable to escape. So this individual really loves this therapy as a result of that. And somebody else, I really like coming on Thursdays and look forward to it. I like the people I go on the walk with and feel better after the group walk. I like looking at the trees and listening to the birds. It's good to sit down with people. So one of the interesting parts of the forest therapy that we do is very much the kind of different parts of the invitations that we do are group activities, some are individual activities, but we always end with a group activity, which is sitting down, maybe sometimes standing, depending on people's ability to sit down. And we have tea and we share food. And people might talk about things that they've experienced on the walk. They may share things that they've picked up. But there's something about that, not having to maybe talk about what's going on in my life for this period of time. This is just how I feel in this moment and now. And having other people do that as well provides that sort of act of open sharing and connection, which is something quite unique to forest therapy. Okay, next slide. So, especially in England, we do have a real issue in England for forest therapy to be recognised as a therapeutic activity and to be prescribed to individuals who have poor mental health. In England, we have a national health system which everybody pays into. Unfortunately, it's not in a very good state at this moment in time. We're hoping that things might change in the near future. But what they call green prescription is something that is being introduced into England. It's already active in Scotland and Wales in the UK. So this means that your doctor quite literally can send you to a group which is being funded by the health service to provide a natural type of intervention. At the moment, our funding for this project comes from grants. So we've been very lucky in our area to be given a number of grants from grant providers that recognise the nature intervention and the benefits of having a natural intervention, but also that kind of, social isolation, getting people together and getting them together in nature, and also practicing a type of therapy that people find really beneficial. So there is a need very much, I think, because we know that there's this kind of exploding market of people jumping onto the bandwagon for training. in green therapies, but we really do want to sort of work with an organisation that is setting a standard for training, and hence why we've started to work with Forest Therapy Hub. I've known Alex for a number of years, and I know that it's very much about ensuring that there's a good standard of training and that people work in a safe manner, especially if they're working with clients that have mental health issues. So that's why we're working together with Forest Therapy Hub, and it's a new collaboration, but it's a very exciting one. And I'm really open. Both me and Evelyn are very open to questions, and Evelyn is a Spanish speaker, so if you feel confident and want to ask those questions in Spanish, that would be really useful.
Can I just following on from that? I have been typing away some answers in the Q&A, so shall I just go through a few of the questions quickly? Would that be helpful? Just to
yeah.
So the first question was whether we offer it only to adults, or any thought about offering it to children or young people in the future. Just to say, within our organisation, when this was introduced, we were working with adults aged 18+, but we've extended our offer of services to 16+. And yes, I think, Angela, I can safely say that we would, be prepared to offer this to young adults. As far as offering this to children, Angela, perhaps you've got a bit more experience around the offer to children, but within our organisation it would be 16+.
Yeah, I'd agree. Yeah. I'd agree there, Evelyn. I mean, at the moment, because we're working with 16+ upwards, we haven't adapted this for children suffering with mental health issues. And if I'm being completely honest, I think we would have to really look at the programme and the adaptation for that, depending on who we're working with and what the diagnosis is.
And there's a question here, Angela, which says, what criteria need to be met for it to be included within the social prescribing field? And I wasn't really too sure what somebody had meant by the criteria. But just thinking about our experience working alongside our social prescribers in the borough, so we work quite closely with the local primary care services, including GP practices, and the social prescribers here in the borough normally sit within the surgeries. And I think really what we do is we look at the needs of the individual. Is this person looking to sort of engage in some more social inclusion? Are they open to being in the natural environment? And looking perhaps for some interventions that will help them manage their mental well-being. So that's normally why we would be receiving referrals from our social prescribers. And there's another question there. Do you have any research of the effect of forest therapy on emotional intelligence? Well, specifically research on emotional intelligence, not directly, but Angela, and please add in if you want to say anything, but just thinking about the feedback that we've received, the qualitative feedback in particular, people have self-reported feeling, more confident, more open, more connected, a lot of the qualities that we would associate with emotional intelligence. So, we've definitely seen, a real impact on people's emotional well-being. Bear with you, I'm just looking at the next one. Oh, I can see there's a request for connection there, so thank you, Maliga, thank you.